Okay. So we'll start off with what led you to try medication for opioid use disorder?
Great. So I was addicted to opiates, primarily pain medication for about 6 years post an accident. Typical opiate epidemic, doctors overprescribing, not really educating patients on the physical dependency aspect alongside with addiction. Got physically dependent and really just ran into a brick wall, consisting of losing my ability to work with doctors. I have a medical background. On my lunch break, getting caught for like prescriptions, fraud prescriptions, getting arrested in scrubs, like one of my rock bottom memories I'll never forget. I'm talking in and out of institution, jails, small thefts, losing my home, husband, children to child protective services, couldn't pass a drug test. So I worked with a provider many years ago, back in 2010, and he started to really, he loved Suboxone, but it wasn't like super, super, super popular then. So I had remembered and I'd reached out to a detox center locally. And I said, hey, do you guys prescribe Suboxone? They're like, absolutely. So I went in, I checked myself in. I waited till day 3 because we didn't know about, that you could take it a little bit sooner back in 2016. They were like, wait 3 days till you're at your peak on withdrawal. You have all these symptoms. And so I checked myself in and got my first Suboxone and realized I didn't have to, because I couldn't withdraw on my own at home.
Hmm. So you knew about it. You said you worked with a doctor who had prescribed Suboxone. Did you know a lot about it? Did you know exactly what to expect? How were you introduced to the process?
Yeah, so I didn't know what to expect. I knew people that were on this is what I thought from the medical perspective, and this is what I hate, and I try to like merge this right here. I thought heroin addicts that were junkies needed this medication to have a stable, normal life after heroin. I did not know being on pain medication was kind of the same thing. I was in the medical field, but I didn't quite understand the mu receptors, and it's all the same bunch, or can it's in at and or around that same circle. So I knew that it helped them with their addiction, and I thought, okay, I'm pretty much a heroin addict, so this has got to help me. And it did. So, yeah.
Great. Okay, so when you went through those first 3 days, what were those like before you were able to start the medication?
Emma, that was hell. I took I had a ex-husband who didn't understand addiction. So I was enabled for a long time. Nobody really understood it in my family. I hid it really well until I started losing everything. They knew something was up. They just didn't quite know what it was.
Hmm.
Um, we had tried the withdrawal process, like easing with Imodium and just comfort meds, clonidine. I was open to one of my providers about it, but they didn't know about Suboxone. So therefore, they're just like, if you can get through the first, 5 days, 6 days, and it'll get better. That's all I knew. So I was just trying to get to that. Third day's the worst, but I had restless leg, sweating, and I started to plan my suicide.
Wow.
I wasn't going to make it. And I knew that. Bottom line, Emma, I just figured out I have to find a timeline where my kids are at school, my youngest are at daycare, they won't find me. I actually purchased a firearm, put it on top of the fridge, had a whole plan. And yeah, unfortunately, the timing didn't line up. And I wasn't able to come out with it. And then that's when I had reached out and I was like, all right, God damn it. I actually called a suicide line and didn't give them too much information, but they were like, you need to really consider detox. And I was like, oh my God, detox. Oh my God, Suboxone. So that's when I reached out to a local detox center. I just Googled and that I had knew about from being in the medical field. And I said, hey, are you taking patients? And they're like, yeah, just come in. So once I got in, they kind of just locked me down. So that was good.
Oh, great. Okay. So once you got to the detox, what was that like?
It was really fast. They were amazing. And it's just a small, it's in like a professional building right next to the hospital over here where I'm at in Texas and Dallas Fort Worth area. And it's like a mental health rehabilitation. And they don't do like long-term residential or anything over a couple of weeks, but they do detox. And so I walked in, I handed them my Medicaid at the time card because that's all I had. And I said, help me, please. And they're like, yeah, 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 fill out this paperwork. I mean, I'm shaking. I'm like, my heart rate is 140. I'm can't hold my bowels or urine at this point almost. And they got me straight back. I said, please, and I'm really just gripping onto the person, the patient care tech arm. And I'm like, please, it was a guy. I know I stunk really bad. I couldn't shower, brush my teeth, hygiene. I said, please help me. And he goes, we will. Just, we have to check you in. We have to check you in. And they got me back. And I would say within a couple of hours, they introduced my first Suboxone.
Okay. Did you start at, I guess at that point it would have been, the full 2 milligrams and more throughout that day. It wasn't like microdosing or anything like that.
No, it was actually 8 milligrams. He did the 8 and 2 because I was on day 3 of
Right,
withdrawal.
right.
And my level was really low, he said. So he said, let's just go ahead and do that. And I remember standing in the med line. By the time I sat down, he said, drink the water, and he wanted to see my reaction. And I said, oh my God, it was like things just kind of cleared up. It was like looking through, trying to look through a cup of coffee and looking through some water now. I was like, okay, I felt my vitals kind of return to normal. I was like, I think I'm okay, but I don't really know. And he's like, okay, well, we'll start there. Go back to your room, and I was like, I think I'm hungry. And I hadn't eaten days. And I was like, I think I want to take a shower. And he's like, that's good. This is good. This is good. This is normal.
It reminds me of, I don't know if you've seen the original study when Marie Neiswender and I think it's Vincent Dole had discovered methadone, right? They were methadone maintenance. Methadone already existed, but they had 2 patients. They had given them all kinds of opioids to try to see if they could help them. And then finally they gave them methadone. Nothing was working. And they started showering and they were like, we want to go to classes. And they were like, the doctors were just
Yes.
like, what is going on?
Yes. I want to do
They literally just,
something
yeah,
and
they just got up and started
not
doing
die.
stuff. They started
Yeah.
painting, going like,
Yes, that's exactly. And I have never heard that analogy. So, or that story. So, in hearing that, it really just gives, that check mark of what I was feeling was what other people feel.
yeah, it's great.
Yeah.
So how did you feel? How did you know when you found a stable dose?
That's a really good question. So I had a really great intake detox doctor, and he was very communicative and just was making sure that my cravings were managed. He said, "Okay, now that you're physically feeling better," and followed up within 24, 48 hours. How are you sleeping? That was a big question.
Mm.
Are you nervous all the time? Are you, and I'm like, yeah, I am. And he's like, this isn't typically where I want to be. He said he really likes that 16 milligrams, especially in the beginning. So he went up a dose, and then that's when I remember everything just kind of coming together. That me really wanting to be in the classes, I actually got on the phone to call home. I wanted to visit. I started coloring and kind of working some step work. And then before I knew it, my 10 days was up, and they were having to drag me out, but hugging me by.
Mhm.
Obviously, I don't feel like it was a long enough stay for me, but nonetheless, I would say that 16 milligrams was really my safe place. Yeah.
Yeah, so the anxiety started to fade. You're able to sleep. That's great.
Yeah, no cravings, by the way, none. I wasn't, I was so happy. I was like, God, if this is really happening, like I bargained. I said, if you can get me off of it, I won't go back on. And I made that bargain with God,
Mhm.
and I never did.
I think that's, it's something a lot of people forget that cravings are a really important part of this. It's not just physical withdrawal symptoms. That's I think something I spoke to a doctor for one of the interviews on my Substack before, and he was describing when you would increase a dose. And he said, well, if my patient's looking at the clock waiting for their next dose, that means
Bingo.
they need a higher dose. Like,
Yes, absolutely. Because right now, for example, I just dosed my second dose, but hell, sometimes I make it 3, 4, 5 p.m. I'm supposed to dose it. I haven't even thought about it. You know what I mean? But that means that I'm stable.
great. Okay, you mentioned in the beginning that your family didn't know a whole lot about addiction. How did they respond to you being on Suboxone?
I have no support with Suboxone, and that's okay. My mom and I have a very rocky relationship, anyways, as she suffers from the disease of addiction. So does my dad. It is, I believe, genetically predisposed. I believe in that totally 100%. She doesn't quite understand it, but she stays in her lane, knowing by seeing the proof that I'm putting out there. I've never had my own home that I'm sitting in. I've never had a career doing so well, blossoming. I've never been this stable finance. She's just seeing the results. So really, what can she say at that point? And that's really what I tell her. I said, chime in anytime you feel like you should about my treatment, and when you see me go down. And the only time she's seen me go down is when I attempted to get off and wasn't ready.
That makes sense. Well, could you talk actually a little bit about that? What made
Yeah.
you decide to try to stop and how did that go?
Yeah, so I did it short term. I did 30 day, they gave me a 30-day supply upon discharge from detox.
Mhm.
And I was, they were just kind of like, you're on your own. I did great with that. I did that, got off. However, I didn't understand the disease of addiction
Mhm.
quite. I see it from a medical standpoint, but when it's you, it's different, right? So I was like, okay, well, I'm cured. No. So I swapped drugs of choice and I went to, methamphetamine, and I toggled with that until I caught charges that landed me in incarceration. But knowing when I got back from incarceration, okay, so here's reality. I have no medication. Um, I was white knuckling my life. Bottom line, I mean, as much as I'm clear of it. I don't have it in my system. I haven't even had Suboxone in my system, but I reached out to a doctor local to me that does manage Matt, right? And I said, hey, I'm like miserable. I can't keep a job. I don't want to be in a relationship. I don't want to be touched. I'm snappy with my children. Like, I don't know. And he's like, you know what? Why are you not on Suboxone? I mean, like, have you considered Matt, like long term? And I was like, no. I more so thought Suboxone was for that beginning stage. And he just broke it down a few years ago and was like, no, it's not nowadays.
So how did you get started on it again at that point? Did you have to titrate up slowly?
Yes, he did that. We started with half a strip, and at that point, it was pretty bad. Emma, I was not happy. I was so bedbound with depression. I actually passed a DVT, which is a blood clot in my leg from inactivity. I was not working. I was about to lose my home, my relationship. My partner now had walked out on me, and he's like, "I'm not sure what you got going on." It almost looked like addiction, but it was the opposite. It was me being in recovery, but not working recovery. And I was just white knuckling another day clean, another day clean. I just have to get this clean time, right? Of no substances. So once I've found my stable dose, that was actually 24 milligrams. And I hung out there for about 3 months, and then we lowered it back down to 16, where I'm currently at.
And so outside of the medication, what other things have been helpful to you in your
Yeah, definitely the biggest thing is working my steps. I really like just the general outline of step work.
Mhm.
Sponsorship, I don't really say sponsorship. I love the mentorship, finding someone that you can kind of lock in with that can hold you accountable, that can show you the way, that has a little bit of clean or sober, whatever you want to call it, time. Because we're human nature is to have that connection, and we need it, especially in recovery. It's scary, we don't want to go back, but we don't feel good here. What do? We need to look to someone else who knows. So finding your people, definitely activity is important. I even just do stretching, yoga, meditation. Just pop on a YouTube and I just pull out my mat, vibration plate. You don't have to go out and get a freaking gym membership and pump iron, but just little things. And my biggest thing, Emma, is consistency and staying on a regulated schedule. I
Mhm.
have to be on my schedule, make my bed every day, make my coffee, set my clothes out. I can't have any wrenches thrown in the day if I can avoid it. If just that consistency in life and in recovery really helps.
I mean, that's huge for a lot of people, I think. I mean, in any kind of mental health, my family and friends make fun of me because I have a very strict bedtime. I get up and I go to
Yeah.
bed at the same time every day, even on the weekends. And I do like I'm moody. If I go to bed a half an hour late, I don't sleep as well and I get really
Yes.
grumpy the next day. Like it
Yes,
does make a
routine.
difference.
It does. And especially when you get really tapped into appreciating life and valuing every second of every day and time and how it's just of the essence. And you really do value that. And you really, just small things like not letting laundry get overloaded, because then we're triggered, emotionally, like, oh, I'm overwhelmed, I can't fucking do shit, and then you just want to, it can bring up yucky feelings that could have been avoided just by forcing yourself to put your laundry away. Now you're overwhelmed. You're not even putting the clothes away. Next thing you know, you're like this close to calling the dope guy because you don't feel good. Now you're just crying and upset, and it just can snowball into something so much bigger when it doesn't have to.
Okay. And you kind of hinted at, going back to school and working again. So what are you doing now?
Right. So I'm a nationally registered certified medical assistant. And that's what I originally have done, working in various practices. I worked for temp agencies, but I work alongside a internal medicine provider at this time. I'm his only employee. It's just him and I. He knows about my past of addiction. He sees my social media, and I've kind of always been transparent about it. I don't offer the information, but if they ask, I definitely am confident with my treatment that I'm on the right, plan. And I've never had anyone say anything bad about it. Yeah.
Great. And how did you decide to start sharing your story and information on social media?
The stigma, the fact that I've buried so many people, the fact that so many people are staying in addiction because they're afraid of a medication that's managed by a provider. It doesn't make sense. My kids, I want that open topic. If you're hurting, if you're sick, we have doctors, we have options. Physical dependency and addiction are very different, and they're defined by behaviors. And there's such a big difference. And the stigma is killing people, bottom line. And it's unnecessary. And so I feel like just go ahead and let them judge you, because so far I've saved lives and I'm going to continue to do that. And I said, if I can just get on here, I just decided to hit record after I started Suboxone a year ago and been consistent with it this time. Happiest I've ever been. Jumped on TikTok. I have 6,000 followers later, and I've led over 200 people to different resources, got over 75 people on that. So
That's amazing. Yeah. I was just going to ask what kind of feedback you've gotten. Is there anything else you want to add about that, or is that pretty much?
yeah, that a lot of people think that you have to go to a clinic. A lot of people think that they won't take your insurance. A lot of people think that you can't be clean, or that you have to be clean. Excuse me. That these are not. This is not the case. There's so much misinformation. It's just as easy as clicking an online telehealth provider in your state. Some of them take insurance, some of them do not. However, you can still use your insurance to pick up the medication. And I try to tell people that all the time. I pay out of pocket for my doctor $100 a month, but my 2K, $2,000 worth of meds is covered with my federal insurance.
Mm.
And I don't leave my house. It's from the comfort of my phone. I go to a local drug testing facility that they send the order with. She's not even near me. She's in Texas. Just kind of that there's so many online resources. I'd much rather someone pop online and get Suboxone than teeter with what's outside.
Yeah, absolutely. Okay. Do you hear a lot of misconceptions about MOUD, either, from patients or even family members or medical providers that you come in contact with?
Yeah, it's crazy because I've worked with over 75 to 100 providers, especially temping, and we've talked about, especially the past couple of years, Suboxone. And doctors are like, I don't understand why patients think that we judge them as much as we do. I just need to know the truth so I can treat my patient. They want you to be honest. I work alongside a doctor. I dictate for him, I help patients, I educate. And he treats anything from substance use disorder on down to sleep apnea. So all providers need is, we know you slip up. We in the medical field, we know you're not perfect. Obviously, you're coming in with a disease, a mental health disorder. It's not going to be linear. Be honest, advocate for yourself. I really want to teach patients and people how to patient advocate for yourself. You've got to talk. They don't know. They're doctors, they're people. There's a lot of misconception about being judged going in, where to get it, how easily accessible it is. And most of the stigma is from the outside, people. It's not really from the inside the medical profession on my end, anyways.
'Cause I do hear people, say that they've had bad experiences. I hope that that's getting better, but do you
Yeah.
have any suggestion for someone who has had a bad experience with a doctor, how they should
Yes.
advocate for themselves going forward?
Great question. I have a couple people message me that their doctor just isn't their doctor, and that's okay. And I do believe in doctor hopping,
Mhm.
not doctor shopping, but doctor hopping. Find who you need to be with. You're getting treatment and hopefully long term for something, and you need them to understand, listen, comprehend what you're saying, not just, listen, but listen, truly listen to you. And if you don't feel seen, heard, valued, exit and tell them, I really appreciate it. I'm going to be searching for another doctor. What is your protocol procedure for when I do find them? Because I know I'm in a contract for controlled substances.
Hmm.
Just advocate and don't stop until you find somebody who you're happy with.
Okay. I think those are the main questions I had. Is there anything you want to add that we haven't touched on or that you want to emphasize, even if we did talk about it?
Yeah, if anybody runs across this that has a family member that's suffering from the disease of addiction, there is treatment. It is, less likely to be abused than staying in addiction. And just sometimes it's better just if you don't have anything nice to say, don't say anything at all. And sometimes the option is the Suboxone or methadone or burying your family member. And honestly, for my children, I would shove either one of them down their throat medication wise, and deal with the addiction aspect from the medication standpoint, then try to pick out a casket for somebody. So please, if you don't like it, that's okay. Just shut your mouth because it works. And bottom line.
Great. Okay. Well, I'm going to work on editing this and I'll probably post it next week and go out via email. If you want, since you're making content too, I can send you the video. I mean, I'm only planning to use the audio, but if you wanted to take clips for yourself, I'm happy to send it to you if that's useful.
Yeah, that would be
Yeah.
useful. Thank you so much, Emma. I appreciate it.
No
You're
problem.
saving lives. Keep it up.
You back at you.
All right.
Talk
Bye.
soon.